thank you for that, Sita. So if it's all right, I'm just going to spend 5 or 10 minutes now just debriefing what we've just gone through. I've made some notes, if that's okay. So our goal here altogether is to improve, isn't it? And to improve patient safety, to improve working together. So there's some of the things that we're going to talk through today. Please respect one another when each other's talking, one person at a time. And hopefully by debriefing we'll have some learning to take away from today. Mm-hmm. All right. So, Sita, how did you think that went?
So I think it went okay, actually. I was called to see this unwell gentleman. I think I recognised that he'd had an anaphylaxis reaction fairly quickly. So I was able to give him his adrenaline, which is what he needed. I didn't know the dose of it. So I had a look at the guidelines to just make sure that I was giving him the correct dose. But he got that treatment quite quickly, I thought, and then I reassessed throughout the simulation and recognised that he was improving, but not as well as I would have liked to. So within a few minutes we gave him another dose of adrenaline. So overall I thought it went okay.
Yeah. Thank you. You've given a really nice short summary there of what happened. What was the diagnosis then in this case?
So he had acute appendicitis, for which he'd had a dose of co-amoxiclav, and unfortunately he is allergic to penicillin, and this resulted in an anaphylaxis reaction. And so yes, that was the diagnosis, the anaphylaxis reaction.
And does everyone agree with that? Everyone happy that that's the diagnosis and the short summary?
Yeah.
Okay, so any other points that you guys want to particularly bring up from that short summary? Or
I think you just talked through your thought process really well during the scenario, and kept me aware, and I think
definitely I felt as the patient, I felt really involved, and you spoke to me and told me what was going on at the time, and told me I was having an anaphylactic reaction as the patient, so there was really good communication there, I think.
I think there were a lot of things that went right, and you did very well. Was there anything, thinking back now, that you would want to change before we've had discussions?
So one thing I did feel was my A to E assessment got stopped halfway through. So I did A, B, and I started some treatment at B. I then moved on to C, and again we did start a little bit of treatment, but I recognised at that point he was having an anaphylaxis reaction. So D and E I felt got left a little bit, and then the second time I reassessed, I did go through D and E. But the first, I think I should have done a full A to E in the first instance, and then gone back to, and then started the treatment for anaphylaxis. But
that's an interesting thought. So do you feel that if you'd done that full initial A to E in the first 1 minute, which is the typical time, isn't it, it takes, do you think that you might have changed your management then, or your order of management, should I say?
I don't think it would have changed my management, because he needed adrenaline, which is the thing that he got very early on, and I think I gave it after my C assessment. But it's a very quick assessment, as you said. I can do it within a minute, so there was nothing really to stop me from doing D and E very quickly and then coming back to the rest of the assessment.
Yeah. And I just wonder whether, you started by giving nebulizers, didn't you?
Yeah.
And do you think possibly that had you done that A2 initially and seen his rash and seen the swelling and got to those aspects, you might have changed and gone with adrenaline first?
Quite possibly, yes. And I think, so the reason I gave nebulizers was because he was wheezing, he was audibly wheezing, and I thought salbutamol would help ease his breathing initially. But if I'd got through the A to E, I would have recognised that allergic reaction and anaphylaxis sooner, and been able to give it to him. So yeah.
Okay, I think that's really helpful to think through. There's one point I just want to pick up on a little bit. I noticed when you initially gave a neb, Ella, you asked, do you want this through oxygen or air? Can I ask what your thinking was during that time?
Well, I guess his sats were a little low, weren't they? About 90. I thought, maybe oxygen could help. But Sita knows what she's doing. She's the doctor, and salbutamol will help as well. So, yeah, I guess I just didn't question it at that time, really.
Okay, thinking now in hindsight, with SATs of 90, needing a nebuliser, what would you think would be the right thing to do?
Well, as you said before, probably oxygen wouldn't hurt. Probably get those SATs up at the same time. I guess you could do both, can't you?
Yeah. And what do you think now, Sita, about that?
I think I agree actually, because his sats were low, and I had a quick look through his observations chart, and they'd actually been normal prior to this, so this wasn't normal for him. So he'd acutely deteriorated, and in hindsight I should have given him high flow oxygen. And the nebulizers would have helped, but actually he needed oxygen as well. So
and giving him maybe with oxygen, could have done.
So actually that would have helped. And in hindsight, that's what I would have asked for.
Yeah. So I'm just interested, Ella, as to, you clearly thought oxygen might be the best thing, but then when Sita said air, it wasn't questioned. Was there any particular reason for that?
Well, I think just she's more senior than I am, and in just that moment there's a lot going on. I guess I just didn't question it, and possibly I should have done. And so going back to that good communication, we did have good communication, good rapport. Only takes a second, doesn't it? But I think I just accepted it. I didn't really question it any further.
Yeah, it's really interesting, isn't it? But I think that's something that in practice happens quite regularly with seniority and hierarchy, is that we don't always question, but we've got quite a powerful voice, and it's something that, if we do pick up on and question. Would you have been upset if that was questioned, or? No,
I think it would have made me think, actually, do we need to give oxygen? And so I might have changed my mind actually if it had been just brought up. But it is a very stressful situation with an acutely unwell patient. So I think I just thought, let's give the nebulizers quickly. But I think I would possibly change my mind, particularly if it had been questioned. So don't feel afraid to ask and say.
It's a really helpful discussion. Yeah. Stanley, how did you feel?
I felt listened to. I felt communicated with. I was updated all the way through, so I think there was really good communication with me as a patient personally, from both of you actually. Always being told what was going on. So,
Did you feel confidence in Sita managing you?
Yeah, there was. It felt like a very confident assessment, and from the patient point of view, I felt like I was being looked after appropriately.
She certainly talked to you throughout, didn't she?
Definitely,
and told you what was going on, and
every point there was good communication from both of you actually, in terms of what you were doing to me, and when you were taking observations or when you were talking through what had happened. Definitely.
Two last little points, and then we can summarise. One is, I just wanted to ask all your views on a patient with acute anaphylaxis, whether we sit them up or lie them down, and what your feeling is on that.
I think it depends on what where the patient's at in their sort of anaphylactic reaction, really.
Right. Do you want to talk about that a little more?
So I guess if they're really short of breath and they're struggling with their oxygen levels, then you want to sit them up to help them with breathing, possibly. But if they've got really low blood pressure, you want to lie them down so they can perfuse properly. Yeah. Maybe even raise the legs.
Yeah.
Hello, anything extra?
No, I don't know whether I would lean more towards lying them down, just because the risk of anaphylactic shock is so high. But if their blood pressure's fine, I think it'd be justified, and they were struggling in sitting them up.
Yeah, I think I agree. I'd focused on his saturations and B, so that's why I'd suggested we sit him up before we'd got the rest of the C and D and E assessment. So, but I think if he's in shock, lying him flattened, as you said, lifting his legs up would have actually been the right thing for him.
Lastly, I just want to talk about what we do next with communication with Alan, because clearly we made a mistake, didn't we? We knew he had an allergy to penicillin, but we gave cefotaxime. So what would happen, do you think, later on after his operation? What would need to happen?
So we have a duty of candour to talk to the patient, to apologise to him as well, and explain what had happened. We need to fill out a DATEX form as well, and to really understand how it's happened, and it's not to lay blame on anybody, but it's to make sure that it doesn't happen again. So whether it's an audit or a root cause analysis or something like that, and I think that's something that we should feed back to the patient as well, to explain that we've done this to try and prevent situations like this happening again.
Thank you, absolutely. So if I can just summarise, if that's all right. Are there any other points anybody wants to make before I do? No, okay. So this was a case of acute anaphylaxis following an antibiotic that Alan was allergic to. What I was wanting is to understand the algorithm and to use the algorithm medically, but also look at teamwork, how we work together and how we communicate as well. So they were my main points that I was looking for today. I thought it was a really good scenario. I thought the communication was effective and excellent throughout. And equally, I thought that you picked up anaphylaxis, you did your A to E, and you treated anaphylaxis appropriately. When you realised it was refractory, you gave that second adrenaline after 5 minutes, which is excellent. I think there's a few little learning points. One is when we have low oxygen sats, we should think about giving high flow oxygen, particularly when we're in shock, and we aim to keep the oxygenation to about 94 to 98% if we can. Obviously, treating with IM adrenaline first as soon as we pick up that it's an anaphylactic shock, and then we've talked about sitting up versus lying down, haven't we? And probably lying down when we're in shock, but if wheeze is the main symptom and shock isn't present, then absolutely sitting up to help breathing as well. Any other learning points that people have picked up?
No, I think from my point that was everything. Yeah.
All right, well, thank you all so much for engaging in that. I think it's been really helpful, and I look forward to doing the next simulation with you.
Thanks
Thank you
very much.
very much.